This video is about antimicrobial resistance, the silent pandemic. So imagine a world where simple infection like pneumonia, skin wound infection, urinary tract infection can no longer be treated with antibiotics. This isn't just science fiction, it's already happening. Antimicrobial resistance, or AMR, is killing millions of people every year, especially young children. Let's talk about the rise of superbugs and what's fueling this crisis and what can be done about it. So, what is AMR? AMR is antimicrobial resistance. That means when bacteria, viruses, and fungi or parasites they stop responding to medicine, antibiotics, antivirals, antifungals, once life-saving no longer work very well. The result is longer illnesses, more complication, and higher death rates. WHO calls AMR, antimicrobial resistance, one of the top 10 global public health threats. Estimated 5 million deaths per year. 5 million deaths per year is linked to resistant infection. Children under age 5 are disproportionately affected due to a weak immune system. By 2050, AMR can cause more deaths than cancer. So, what are the causes of resistance? Overuse of antibiotics for viral infection like cold and flu. It's misused all the time, and I'm very reluctant to give somebody antibiotic if I feel that they just have simple cold and flu-like symptoms. Other thing is misuse, stopping antibiotic early or using leftover. I'm just taking it for a few days because it was left over from previous use. That's not the right way, but that will cause resistance. Also, widespread use of antibiotics in livestock and agriculture, and poor infection control in hospital is also the reason. Lack of new antibiotics being developed. It's a very costly affair to develop antibiotic. So you have a rise of superbugs. I'm sure people have heard about MRSA, methicillin resistant staph aureus. There's another one called CRE, carbapenem resistant enterobacteriaceae, and XDR-TB, extensively drug resistant tuberculosis. These infections spread faster, cost more to treat, and have higher death rates. What can be done about it? Doctors and healthcare, they prescribe antibiotics. They should prescribe antibiotic when somebody needs it, and they should be testing for an infection before treating with antibiotic. As a patient, you should not demand antibiotics for viral infection. And once you are prescribed, make sure you complete your prescription. Hospitals, infection prevention and control is very important. Global action, funding for new drugs and vaccines and alternatives like bacteriophage therapy can be very helpful. Antimicrobial resistance is a silent pandemic, and it's already here. We can fight back by using antibiotics responsibly, by preventing infection, supporting research for new treatment. Remember, antibiotics are a precious resource. Once they stop working, simple infection could once again become deadly. So let's not let that future happen. Thank you for watching.